What if there was an FDA-approved way to target tumors that didn't require surgery, chemotherapy, or radiation that you didn't know about? What if it were possible to freeze tumors on the liver, lungs, ovaries, kidney, or breast? What if there were studies from around the world that showed adding an adjuvant to the frozen tumor would allow the immune system to recognize other cancer cells and tumor, causing cancer cell death in the other parts of the body? If you haven't heard of cryoablation and Abscopal Effect, this might be one of the most important videos you've ever seen. What is cryoablation and why haven't you heard about it? According to the National Cancer Institute, cryoablation is a procedure in which an extremely cold liquid or an instrument called a cryoprobe is used to freeze and destroy abnormal tissue. A cryoprobe is cooled with substances such as liquid nitrogen, liquid nitrous oxide, or compressed argon gas. Cryoablation may be used to treat certain types of cancer and some conditions that may be precancerous. What is the Abscopal Effect and why is it so powerful? Abscopal Effect describes the shrinking or disappearance of tumors in parts of the body that were not the direct target of local therapy, such as radiation therapy. It is thought that in the Abscopal Effect, the immune system is stimulated to fight cancer in the whole body as a result of the local therapy. It is not a secret among oncologists that cryoablation is an FDA-approved treatment for many solid tumors under 2 centimeters. Not very well known in the United States, but outside the USA, there are many studies from around the world that show cryoablation combined with a direct injection of an immunotherapy adjuvant or combination of immunotherapy adjuvants has been successful in clearing multiple tumors in just a single session. CHIPSA scientists and doctors have come through all cryoablation studies from around the world and now offer the most evidence-based cryoablation options for local and metastatic stage 4 cancer patients. CHIPSA's 40 years of experience using immunotherapy, combined with our new cryoablation machine from Israel, gives patients options when all others have given up. And if you start combining cryoimmunotherapy options early, studies show it can be more than 10 times overall survival in some cancers. Take this study from Asia. 45 patients with metastatic hepatocellular cancer were followed for 8 years. Those patients who did neither cryoablation or cryoablation plus immunotherapy combination lived 3 months, while those doing cryoablation lived 17.5 months. But astonishingly, the cryo plus immunotherapy group lived on average 36.5 months. To put it in perspective, the average patient who is never offered even basic cryoablation treatment would only live 3 months with this terminal disease. Yet there might be minimally invasive treatment that can be used to give someone 3 more years of quality life. It reads, results. Median overall survival was higher following cryoimmunotherapy, 32 months, or cryotherapy, 17.5 months, than in the untreated group, 3 months, and was higher in the cryoimmunotherapy group than in the cryotherapy group. In the cryoimmunotherapy group, median overall survival was higher after multiple treatments, 36.5 months, than after a single treatment, 21 months. Here is another study for lung cancer called Therapeutic Outcomes of Combining Cryotherapy, Chemotherapy, and DCCIK Immunotherapy in the treatment of metastatic non-small cell lung cancer. This study's overall survival doubled for stage 4 lung cancer patients that at least did cryoablation and nearly tripled for those patients that did combination therapy with cryoablation. It reads, in conclusion of combination of cryotherapy, chemotherapy, and DCCIK immunotherapy proved the best treatment option for metastatic NCSLC in this group of patients. Another overview of many cryoablation studies called Cryoablation and Immunotherapy, an overview of evidence on its synergy. Cryoablation is proven to be successful for local control in various cancer types, and also says, particularly given that cryoablation provides a pool of antigens visible for the immune system to induce an immune-specific activation directed against the tumor cells. According to the paper titled Cryoablation and Immunotherapy, an overview of evidence on its synergy, cryoablation may be synergistic with the immune system in the way cell death is induced. After ablation, the tumor remains, releasing various factors attracting the immune system. A proposed theory regarding the potential mechanisms of cryoablation and the immune system is the danger theory of Matzinger. This theory proposes that after cell death by necrosis, cells secrete danger signals. These danger signals can initiate an immune response. In addition, these signals can mature dendritic cells, DCs, to full active T cells that may lead to a specific immune response. Cryoablation induces cell death by necrosis in which intracellular contents are still preserved while DNA, RNA, and heat shock protein, HSP, which can induce danger signals, are released. Basically, by freezing a tumor, you can cause the cancer cells to die by necrosis, which is an immunogenic cell death. This type of cell death allows the immune system to identify other cancer cells in the body. When other cancer cells and tumors die in different parts of the body that are not cryoablated, this is called the Abscopal Effect. The Abscopal Effect was first noticed in patients given specific doses of radiation. Cryoablation is thought to be an even more effective way to utilize this immune response, delivering antigens to the appropriate cells in the body, thus killing cancer cells throughout the whole body. Some scientists like to describe cryoablation plus an adjuvant immunotherapy as the ultimate personalized cancer treatment. This is because you are freezing and killing cancer cells with the cryo, then adding an adjuvant immunotherapy directly to the site of the cryoablated tumor, thus making a vaccine in the patient's own body. What is an adjuvant? An adjuvant is a substance that enhances the immune system's response to the presence of an antigen. They are commonly used to improve the effectiveness of cancer treatments. This cutting-edge technology has only been done by a few leading-edge interventional radiologists around the world and is now available at Chipsa Hospital. So how does the cryoablation plus immunotherapy procedure work? Depending on the type of cancer, our interventional radiologist will either use ultrasound or CT-guided imagery to find the proper location of the tumor. A small cryoprobe is then guided directly to the tumor, where an ice ball will be formed at minus 202 degrees Fahrenheit, freezing the tumor and killing the cancer cells. Then, specific immunotherapy will be added to the tumor to alert the immune system. If the correct immune response is obtained, then dendritic cells will present the tumor antigen to the rest of the immune system, thus giving the possibility of a systemic response to metastatic disease. Furthermore, Chipsa doctors will continue to stimulate the immune system throughout the patient's treatment, providing an even better opportunity for the patient to receive a systemic response to their metastatic disease. If you or a loved one would like to see if Chipsa can use cryoablation plus immunotherapy to help, don't hesitate to call now to set up a free doctor's call.